or just tell us what's wrong with it so we can fix it. Collection agency reporting. We don't, if you have a collection agency that you outsource to do all your billing or whatever, they're going to help you with that part. Payment posting, again, when a payment comes in, just add it to the books. Just process it the way you do as far as accounting goes, you know, cash flow and whatnot. So if we go, there we go. I kind of went into this already a bit, so just review of this. Your member name, date of birth, member ID number, group number, which is all on their insurance card. More and more insurance companies are allowing for online checking of benefits. They've got customer service centers that are huge. They want to try to reduce the amount of volume that they get on those calls, so they're trying to get it to be more of an online process. I'm still in the works of trying to figure those out. You do have to sign up, basically make a profile, a username, password, etc., before you can log into any of those, providing things like your NPI number, your tax ID number as a company, things like that before they actually let you have access to that information. A little bit more about like, number 2, insurance verification, those kind of things.
So when you call like the insurance companies and stuff, like and ask for all that information, is the client there, or like how do you do that? Like when the client like first walks in?
Yeah, for sure. So that one, that's a question that will vary from practice to practice. How you do it, how many people you have on staff. Do you have a billing analyst that can do that for you while you're in session? Those kinds of things. It's up to you. I mean, if you are the only person running your own practice, take their insurance card, boom, go have the session with them, call them at night. I don't know. I don't know when else you would do that. Set aside some time in your schedule to make insurance calls. Hopefully your practice is kind of big enough that you can have someone solely dedicated to doing this kind of stuff, because it is a big job.
About how many hours do you spend doing this per week?
20 hours.
About 20 hours?
Yeah, 20 hours. Work part-time, doing only insurance, calling insurance. There are a number of therapists in our office that do accept insurance, so it's not just for one therapist. I would say 5.
Is there 5 of us now?
5 that accept insurance, so I'm kind of checking insurance for 5 therapists clients as they come in. So definitely intakes take priority. You know, we just try to process those right off so that we can get that 30-day to 6-week process started as soon as possible to get the remittance back and know what their coverage is exactly. Honestly, some insurance companies are really good, and I can have information back in 2 weeks easily. So it just depends on how backed up their company is, how their process is run. Anyway.
What insurance companies are those?
Good question. I don't know off the top of my head. I don't know. Some of the bigger ones obviously have a little bit better handle on their processes and things like that. So if you ever want to submit claims electronically, you're going to need to familiarize yourself with terms like EDI, which is electronic data interchange. Okay, so that's when a clearinghouse, I think that's on my next slide actually. Let's get to that. Yeah. Oh, there's HICFA. Okay, we're going to pause on the clearinghouse. I'll get back to that in a second. But so this is a blank one here. And then over here, you can see how it's been filled out with the name, address, the telephone number, their status, their date of birth up here in the top, their status as single, what kind of visit it was, and if there's anyone, like for example, if there's
this is a fictitious person, right?
Yes,
of course.
Yeah,
I just want to be clear for the video purposes.
Yeah, I don't. Plus, it's too blurry. I don't even know what their name is. But let's say the husband's got the insurance card in his name, but the wife is seeing the therapist. Then you'll put his name as the insured person, and then the person that's being seen for services, Here's the ICD-10 code goes here, the dates of service go here, the location that you provided the services are coded here, and also the CPT codes here, and cost, charge, number of charges, and then the NPI number for the therapist that is providing services. So all of that information is best to have beforehand so you can just crank that out. Otherwise you're like, okay, what's next? And then you have to go find it. You may have to do that for the first couple of them, but after a while you get the hang of it. Type of services, charges, address, sign it, and send it off. Now, if you did that, this hard copy, you find out the claim address for the insurance company, mail it in. It's as good as done. They're gonna receive that claim, process it, and give you payment back. Now, in our office, we use a program called Therapy Notes that is basically an online service, pay for it monthly, whatever. You input the client's information into their lovely user-friendly interface. I love it. Seriously, had I had to deal with that, I would have been like, no thank you. But you just put it in Therapy Notes and it populates these for you. Okay, so there are shortcuts, there are easier ways to do it, but I wanted to show you the behind the scenes before I,
Of all the systems I've ever used, I love Therapy Notes.
Therapy Notes is pretty awesome.
Yeah.
Question, do you have get the client's signature that you can use an outsourced place to populate it for information, like say they get hacked or something?
So they are HIPAA compliant. So as soon as that client signs their HIPAA form,
Okay.
they're good. Yep.
Yeah, there's protection. It's HIPAA compliant, so it's secure, networked process that, yeah.
Okay, so that would be the case for online user interfaces like Therapy Notes, also for the clearinghouses that I'm going to get into here in a minute. It's all secure. Okay. They have to abide by HIPAA compliant rules or else they would go out of business. So, okay, here we go. So know the difference between a clearinghouse, an insurance company, and a healthcare administrator. Anybody have any idea what these are? I'd never heard of them before I learned about insurance. Okay, me neither, until now. Clearinghouse. All right, so the clearinghouse is like the hub. It's essentially the electronic hub that allows mental health care practices to transmit electronic claims to insurance carriers in a secure way that protects the protected health information. Additionally, clearinghouses offer medical billers and billing managers a way to consolidate all their electronic claims and manage them from a single location. It's huge. Think about it, the thousands of HCFAs that they get. This comes in really handy because they're doing quality checks, they're making sure all this information is in there. That's what a clearinghouse does. And it's manageable on the practice side from an online dashboard or control panel similar to online checking. So you know how you go and check your bank account? Somewhat similar as a clearinghouse, and they manage all the HCFAs for you. You can submit claims online, they populate the HCFAs, and then send you an email for rejections or updates like that of the status of this such paperwork like that.
And how do the clearinghouses get paid?
No idea.
No idea?
I have no idea.
They don't take a small chunk?
I don't know.
Yeah.
I know that some of them do. Like sometimes in Therapy Notes, I'll get a notification like this claim will cost you 14 cents per claim to send it through this process. So maybe they're taking a piece of that pie. I don't know.
Yeah.
But here's a couple of examples of clearinghouses that I'm aware of: Office Ally, Claim MD, Navicare, Apex EDI, Availity, Zermed, Relay Health, and on and on. Now, in order to use one of these clearinghouses, it also requires an enrollment. Somewhat similar to paneling with an insurance company, but a lot simpler because you're not actually paneling. You're just enrolling to use the clearinghouse. And it's basically going to be an online process. You submit, a couple things for them to review, an application, and then they send it back and you're good to go. And that clearinghouse will process all of the data on your HCFAs before it even reaches the insurance company. So it really streamlines things. And so you're not having to directly deal with the insurance companies, which can take a long time. Especially if there's an error on your HICFA, then it's gonna, they're gonna have to mail it back to you or whatnot. But if you do it electronically, the clearinghouse catches those errors, shoots it right back to you in an email and says, hey, we need this information to get this claim submitted correctly. So, any questions on clearinghouses? I'm gonna keep going.
That is a service that we need to require, like, or
It's
it's included, or?
It's important. It will come in to play if you bill electronically. So, if you use a program, if you want to do it digitally, online, then you're probably going to interact with these clearinghouses at one point or another. If you're just mailing things in, mailing HICFAs in, you're never going to need these guys. But to do it digitally, paperless, it's a lot faster and it's a lot more error-proof. You can catch the errors a little bit quicker digitally. So it's just information, just an FYI. Yes. Again, common insurance companies are not clearinghouses. Different. So it's like those blue arrows. Those are the different insurance companies that the clearinghouses route to, but you're just giving it to the clearinghouse. Okay. And then they dish it all out and submit those claims. And healthcare administrators are lovely third-party people and companies that when the insurance company just wants to do insurance and they don't want to deal with all the paperwork that goes along with it, they outsource to a healthcare administrator. It's third-party. So for example, frequently I will call Blue Shield of California on the phone and they will say, thank you ma'am for calling, but your call will be directed to such and such department because they are healthcare administrators. And they will give you the answers to those claim questions that you have. So another 10 minutes on the phone waiting for them to answer, but basically it's just, the word administrator, they're the administrators for that insurance company. Separate, but connected. And I kind of mapped it out here, hopefully it makes a little bit more sense than just me describing it. So the provider, we log into the online, let's say Office Ally, we log in, got our information, we want to submit a claim. So we fill out the client information and it auto-populates the HICFA, like I was talking about earlier. This is the digital version. The clearinghouse then sends the populated HICFA to the insurance company. And then, hopefully, the insurance company will send us, the provider, a payment with an EOB. An EOB is an explanation of benefits, basically mapping out and lining out what exactly is covered for this client, how much is going where, how much is still the patient's responsibility, and how much of it goes to the deductible per se. Like it lists everything. If there's an error or a reason for denial, it will also be notated at the bottom of the EOB as well.
So you say that this process we need to run with each client that we will receive.
Mm-hmm.
And this takes like 30 minutes, 1 hour per client. But how long does it take that the insurance answer or approve or let you know the information? Is in that
30 days to 6 weeks.
Okay, and in that time,
Mm-hmm.
how can you work with the client? The client is coming to you, you are checking if the insurance cover or not, and then how you charge.
It's quite the limbo, to be honest. And again, that's going to be one of those things that it varies from practice to practice. Some practices may say, okay, until we hear back from your insurance company, we're going to charge you half. So $120, you owe us $60 for each visit, and hopefully your insurance company will pay the remainder. But we don't know yet. If they know for sure, or if their copay is on the card, then you go ahead and have them pay their copay. But those are kind of things that you have to figure out as you go. I mean, business managers, if it's a larger practice, or you're contracted with a business manager, they can help you make those kinds of decisions.
And for example, what about if you charge the client 60 and then you need to give her or give him money back because the insurance covered more?
Mm-hmm.
Who gives the money back to the client there?
assurance, you as therapist?
I'm not gonna give an authoritative answer on that, but I would imagine that it would be you, or you can hold that as a credit toward their account.
Yeah, that's what typically.
Mhm.
Oh, your insurance company paid more than we expected. We're going to credit your account
So
X amount
moving
of dollars.
forward, you just owe $20 per visit instead of the 60, adjusting it according to what the insurance company pays out. That's a great question. So these are all things that will come up. They will.
And
Yes.
so for like, the clients that you get, you obviously kind of know from the insurance card, like, okay, like, we are definitely paired with this insurance company,
Mhm.
okay, we'll network that. Other than that, then you'll have them do the out-of-network fee, right?
Mhm.
Well, they'll call and then we'll further proceed with the
Yep.
stuff, right? Okay, so it's kind of like but you don't know exactly how much is gonna be covered
Exactly.
until you get the results back.
Yes, you have a general idea, say, oh, I ran into Sally who had a similar account, but you don't know for sure until you get that EOB back
Yeah.
with the outlined explanation of where the certain funds went. Exactly, yes.
I know for some medical, like specialists, like, bone specialists or whatever, you can get a prior authorization, does that play into?
It certainly does. Some plans, again, it varies from individual to individual, and there's a certain plan, they may need to be pre-authorized to have services, or they may not, and you don't even have to worry about it. That's something that you call for, and you remember little circle number 2, where you're calling the insurance company, ask them that question initially. Does this kind of service, mental health, outpatient, in-office visit, does it need pre-authorization? If yes, you want to ask them right then and there, how do we go about getting that pre-authorization? Sometimes, depending on the client plan, the client has to call in ahead of time. Like, for example, EAPs, employee assistance programs, the client has to call before they even come in and make sure that they have coverage and say, hey, I want to use my employee assistance program at such and such place at such and such time. How many visits do I have? That's the client asking those things. But prior authorization, we haven't run into too many of those cases, just in the day-to-day things, unless you want to do what's called a single case agreement, which is kind of like we know you don't cover it usually, but we really want you to cover it. So you like submit the extra information. The therapist kind of gives an explanation of the diagnosis and need for services, and then they will allot you, give or take, depending on the company, say 12 visits or a time frame, say October to October, and those are like the title implies, single case agreements, one time, but you get authorization for it that way. It's a couple more extra steps, a little bit more paperwork, but it is possible.
Sometimes they have to go see their physician first, and then their physician gives a referral. So
that's also something to consider on that initial call. Are physician referrals needed? How long is this coverage in place? Et cetera, et cetera. Okay, so good questions, keep them coming. As far as this little diagram goes, we're now so if the insurance company does indeed have a third-party healthcare administrator that they've networked with or outsourced to, then oftentimes you will have to call them directly. So like I was saying earlier, Blue Shield of California, they use Magellan, or MHSA, Mental Health Systems Administrator. And so this is not always the case, but sometimes, so I just wanted to make you aware that this is a possibility. It often means longer calls, more holding, trying to get, unfortunately, I have been transferred to 4 different people before I found the right place. More times than I would like to admit. But that's kind of the maze I was referring to earlier. This kind of stuff and then after it goes through the healthcare administrator, then you get your payment and EOB from them. Okay. So a lot of big insurance companies, because mental health is such a niche service, they do outsource to administrators for mental health care frequently. Again, you're never going to get rid of this. I think we actually did So if the claim is accepted, whether you got it back directly from the insurance company or through the healthcare, oh my goodness, this is happening.
Healthcare administrator.
The healthcare administrator, then again, in an effort to become paperless, they have set up electronic remittance advice, which is basically an electronic version of the EOB. So instead of getting it in the mail with a nice little check, you get it on your user interface on a certain website that of your choice that you're using to bill. Office Ally, Navmed, all these different places. Again, the explanation of benefits is outlining coverage, payments, things like that. Keep records, keep good records, check the status, follow up with them. Being organized is a must with these kinds of things. You need to know when to follow up, when you submitted the claim, how much you submitted it for, how much they paid, all these things. So a system in place for keeping track is very important. Yes?
So do you have to submit a claim each session with each client, or like, is there just kind of like once it's accepted and you get that EOB information, like how does that go?
That's a great question. Again, that's going to be one that's somewhat practice specific. You can bill per client visit and just have a claim each time they come in, and then it's a steady. After a while, you will have a steady EOB after EOB after EOB after EOB coming in as frequently as you're submitting those claims. But say your client comes in 4 times a month, once a week, then it might be a good idea to submit your claims once a month for 4 sessions. Okay, so it's just, that one's definitely practice specific, and you can kind of find out your own schedule that works for submitting those claims and receiving the EOBs back. But that's a great question. Any other questions on that? Okay. Here are a list of things that could cause a claim to come back rejected. Waiting too long to file a claim. Typically 60 to 90 days from the time of service, that claim needs to be submitted. You don't want to wait too long, but it's okay to wait a little while. If you don't get it to it immediately, because life gets hectic, then it's okay. Submit it when you can. Proper codes are missing, so remember that information on the HICFA. If you submit these things in paper format, it's gonna come back in the mail and say, you need this part, and so it's gonna take that much longer. Hopefully, you guys can find a good electronic system that works for you, and those rejections can come back rather immediately. You can tell within the next day or two if they're going to be accepted or rejected. The diagnostic codes, procedure codes are missing, incomplete or valid. Again, essential to have this correct. By the way, I didn't go into what this actually is and kind of who created it. So HICFA, basically it's an acronym that you just pronounce, HCFA. Healthcare Financing Agency. And it's so that each company is submitting a universal claim, so that it's not in different formats with different information, it's all universal. And more recently, they've actually transferred to Centers for Medicare and Medicaid Services forms. It's called a CMS. Here's CMS 1500. It's very similar, if not the same as this. They just go by different names. But it's a standardized form. Everybody uses it so that it saves time and is more efficient.
How does it relate to like a super bill?
Okay, so a super bill is basically a statement that you print out for the client using your accounting service or whatever program you use for that, listing the dates of service and the charges for service, and is signed by the therapist. You give that super bill, essentially a statement, to the client. The client then takes that super bill and sends it into their insurance company, so that their insurance company directly reimburses the client. Okay, client pays full fee when they see you. You give them the super bill so they can get reimbursed directly from their insurance company. It basically takes us out of their insurance picture. It's rather smooth, actually. So we're not having to fill out HICFAs if they have a super bill, those kinds of things.
So the super bill's not a set form, it's just,
It's basic information you need, service rendered,
dates.
cost. Dates of service, service rendered costs, essentially.
So how do you do, or what, like, how do you know if that client has like a super bill being set up, or how does that go?
Some clients are aware of their insurance situation well enough that they can ask for one. It's something you can offer. Like say if they don't know, they come into your office, they want to see have an appointment, and you say, do you have insurance? And I don't know if it covers this or not. Okay, after 4 visits, we can send you a super bill. You can send it to your insurance company and correspond with them and try to work out, if it's covered or not. It's basically putting the insurance in the hands of the client.
But the client is having to pay for the services?
Yes.
Yeah.
And then right up front, every
Right up front.
session and stuff, and then hopefully the insurance will comply with the client.
So a lot of therapists say, no, I don't accept insurance, but I do provide you with a super bill so that you can submit claims to your own insurance company.
Yeah.
And then the HICFA thing is just unnecessary, you just print out the.
You print out the super bill, and they take that super
Two
bill and
different
submit it.
veins.
Yeah, So it's super bill is generally for therapists who are not willing to play the insurance game.
Or maybe if you're out of the country. I don't know if I got that because I was out of the country. My husband was in the hospital, so we didn't know about the insurance. So we need to pay everything, and then we need to process the claim and everything with a broker, and then the insurance company paid us. But everything was through us, not through the hospital. It was.
Yeah. So
We processed everything, and it was so long. The process took 2 months or more.
That is
like a super bill.
Yeah.
That,
Where you're responsible for corresponding with
everything
your
and all the
insurance company about the claim.
process.
Exactly.
So long.
Exactly. Oh, yep. All right, where did we get? The insurance company lost the claim? Hopefully not, but they have a lot of paperwork coming through, so it happens every once in a while. Pre-authorization or authorization, somebody asked a question about that earlier. If you didn't get the authorization you needed, submit the claim, they're gonna be like, no, we're not gonna submit that or process that because it's not authorized. So they'll send it back to you with that notation. 2 services in 1 day, for example, individual plus a group session. For a lot of programs that do run group sessions, wouldn't it make sense if somebody's coming from a long ways away to see their therapist for an individual session and a group session on the same day? Insurance won't cover it. They'll typically go for the cheaper one. They'll typically cover the cheaper one, but not 2 in 1 day. It may happen, but I've never seen it happen where they cover 2 in 1 day. You ran out of authorized sessions, so if you did get pre-authorization and they gave you 12 sessions and you went over that, they're not going to cover more than 12 because they didn't authorize you for that. Authorization expired, it's the dates of service and you went beyond that, not going to cover it. Patient changes her insurance. You sent the claim to the wrong managing company. So for example, if the client has Blue Cross Blue Shield and you send it to Blue Shield, it's going to come back to you because you need to send it to the right one. Happens, we're all human. The provider isn't paneled with the insurance company. Sometimes you will call an insurance company and say, does this client, we're not in network with this insurance company, do they have out-of-network benefits? Sometimes they say no. So don't worry about sending in a claim to them because they're not going to cover it. It's just extra work for you. Clients out-of-network benefits differ from in-network benefits, which is commonly the case, but.
So it's like the therapist and like that agency to kind of keep record of like how many like authorized sessions are, right? And that just all goes back to like record keeping and just being on.
I have an entire spreadsheet of a client's name, who they're seeing, dates of service, last time I checked, when the authorization is for, the authorization number, boom, 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 boom. It has to be very well kept track of or it's going to be a mess.
And that's all like the billing person's like duties, right?
Yeah, yep. That's on my plate. But if you don't agree with anything that the insurance company comes back with, you can submit an appeal. It's documented as a letter signed by the provider explaining why a claim should be reconsidered for payment. Maybe it's based on medical necessity, maybe it's, you know, one of those cases where Dr. Weir said, I saw them as treating the individual, but their spouse came along, so I've marked it as a couple, but they don't cover couples, so you'd have to go through that appeal process to say, okay, will you please cover this? You should, and this is why. All right. Come on now. There we go. All right, master the maze. Even though it's difficult, it is possible. Takes time, takes mistakes made, lessons learned.
A lot of patience.
What was that?
A lot of patience.
Yes, a lot of patience, not just the kind you see, okay? And if you have any other questions, feel free to ask. Again, this is just a very introductory run through of insurance maze. You can spend hours learning about insurance, different legal things, what constitutes fraud, what, you know, all these things. But hopefully you learned a little something from the introduction. And any other questions? Last go of it.
How percentage of the, how to ask, how much do we pay to the insurance company? Or what percentage of each session is charged by the company, by the insurance?
So when you submit a claim, you write down the full amount. So let's say on the HICFA where you put the charge for the session, you charge $120, you put that $120 there. If they're in network, then typically they have what's called an allowed amount. A certain percentage of the full charge that they're actually willing to cover. Say if it's $120, then their allowed amount, $66. So they're gonna, but again, it will vary from company to company and from plan to plan. So yeah, you have the big companies here, but then each individual plan may have different coverage. So you bill for the full amount, but what you get back is gonna be a percentage of that amount, and it does vary. Does that answer
But
your
you will
question?
know, right? For example,
You would think that you'd start to find, like, learn a pattern. Okay, Blue Shield covers such and such. You know, Health Comp covers such and such percentage of in-network. But that comes back to record keeping and being able to notice those patterns. When you get Bob's back and it says such and such, you get Susan's back, it says such and such, and say, oh, I'm seeing a pattern here. Because their individual plans can vary so much that you may not be able to find that pattern.
but we need to pay, right? Or the insurance will take part of the
You need to pay?
money. Yeah, for the insurance or not?
Nope, that's totally the client's.
Yeah.
Clients subscribe to insurance plans, they pay a monthly or yearly amount to have insurance coverage. And then with that insurance coverage, they have certain benefits that they can use. Say I'm Bob. I'm not gonna be Bob, I'm gonna be Susan.
Okay, be Susan.
Yeah, I'm not gonna be Bob. So Susan, I come up and I want to buy an insurance plan. I want to have health insurance. I want to be covered for me and my family. And so I call Blue Shield.
Yeah, you will pay your amount.
Pay
And
your
we as
monthly amount.
therapists, it's like a free service?
No, you would be the beneficiary of that client's benefits.
So you just like apply, right? Like you said, like you do an application to see if you want to be like on the list.
Panel.
On the panel.
That's paneled, yes.
And that's why you would do it, right? And then it's, you know, your.
And usually there's no fee associated with that.
And the insurance company makes their money from the client. The client.
Exactly.
Yes.
We're recipients of the client's benefits that they're paying for. Okay, so we don't have to pay the insurance company to do this. Clearinghouses might take a little bit for processing purposes, but otherwise, no.
I was thinking whether maybe you are thinking about the insurance that the therapist has in case there is malpractice or in case it's sued or something. I think maybe that's
Yeah,
why
malpractice
asking these
insurance, the
questions
therapist
when
would
we're,
pay.
Like mixing these two things.
Yeah.
I don't know.
Yeah, no,
Just a suggestion.
yeah, my question is like if we as therapists, we need to pay something for this service, or if the
Nope.
insurance company take a percentage of, yeah, what?
No.
Say no. And can we enroll to well, I don't know, if we can enroll to many different insurance,
Oh, yeah.
So of all these insurance companies that I had listed up here,
wherever we want, and
right there. This is just a handful. There are hundreds of insurance companies out there. What it means to panel, again, back to what she was saying about weighing the options. Is this gonna be more work for me, for less payout? Is it worth it to panel with them? You kind of have to make that an educated decision when it comes to that, but you can panel with as many as you want.
Do you know if I'm paneled with any?
You're paneled, I think, with
TRICARE?
military,
And Aetna?
and we're still working on it.
We're still working. I know I
we're in
filled
the
out an
process of
application
paneling.
for Aetna, but
Yeah,
I don't know if it's going through or not.
yeah.
Okay.
And Magellan, we're working with those.
but that you only need to do it one time to choose a company.
Yes.
And then depends
Yeah.
on the
The
client.
beauty is I don't even know what I'm paneled on because somebody else takes care of it. Right? So.
So, once you're paneled up with like certain insurances, you can pay, like, you don't have to deal with like insurance if a client is willing just to pay out of pocket, right?
Absolutely. Avoid it at all costs.
Yeah. Yeah. Full fee out of pocket. That is the therapist's dream.
That is cash in hand. That is
Mm-hmm.
rolling in it. Okay.
Good stuff.
No paperwork or anything with that one. Just